Hi, Steve, Jess, Ed, and Jack. I'm Andy.
I'm Rachel.
And I'm Faraz.
And we are going to present to you our project on rugby and concussions in Australian society.
We will start off by introducing to you the different types of concussions that exist, and then delve into notable concussions in Australian rugby.
We will then discuss practices put into place to try and prevent concussion and secondary impact. We look forward to teaching you and hope you enjoy. What is a concussion?
A concussion is also known as traumatic brain injury. When a force is applied to the head, brain injury can result. A concussion is the shaking of one's brain and when it hits against the skull. A concussion is cellular functional damage and not structural.
There are three types of brain injuries.
The first is subconcussive injuries, which are biomechanically induced injuries with no symptoms. Secondly is concussions or mild traumatic brain injuries. They are biomechanically induced injuries with symptoms, and there's an absence of structural brain damage. Thirdly is traumatic brain injury, which has structural brain damage, and you can see the problem on an MRI or CT scan.
Post-concussion syndrome has symptoms that persist and last a variable duration, more than 3 months and up to 12 or more months after concussion. About 15% of people continue to see a doctor after 3 months of injury because of lingering symptoms.
Second impact syndrome is when another concussion occurs before healing of the first. Second impact can result in brain swelling, vascular congestion, cerebral edema, brain herniation, and death due to pressure buildup and because the brain can no longer autoregulate.
CTE is found in athletes with a history of repetitive brain trauma. It is a progressive degenerative disease of the brain. CTE can only be diagnosed once the patient has died and their brain has been examined. Some signs and symptoms of CTE include memory loss, impaired judgment, aggression, depression, Parkinson's, and progressive dementia, among others.
All concussions need to be taken very seriously. Athletes who have experienced head injuries should not return to training or games before getting approval from a trained medical professional. Children and teens should be treated more conservatively than adults.
Taking action in Australia. As of the 23rd of March, referees have been allowed to issue blue cards to force concussed players from the field. Adults are not allowed to train for 12 days following a concussion, while players under the age 18 are not allowed to play for 19. An ARU Chief Medical Officer, Warren McDonald, said, and I quote, "Our concussion guidelines are there to ensure everyone in our game is educated on how to manage concussions. It is important that we take action on concussions."
James Ackerman was a Queensland Rugby League player who sustained serious head injuries at a rugby league match against the North Devils. He passed away on June 22, 2015, after a fatal tackle which was nothing illegal or out of the ordinary for a rugby league game. This traumatic event shocked James's community and gave insight into the dangerous nature of the sport.
Imagine participating in a sport that gives you a 1 in 5 chance of a serious head injury over a 4-month period. That is the risk rugby players take on every time they step onto the field.
Kids and concussions. Parents usually subject their children to these injuries when they enroll them in physical contact sports like rugby from such a young age. During childhood, kids develop at different rates. Research has shown that kids who had sustained a sports-related concussion can still have impaired brain function up to 2 years later. Kids are more susceptible to long-term damage.
Lack of diagnosis and awareness. Players often do not want to admit to being hurt. Gender stereotypes exist, like be a man, suck it up, man up, don't be a pussy, don't cry, and be tough. Men often feel pressure that they will let down their team and fans if they sit out of a game.
A perfect example of this gender stereotype can be seen in the case of Sam McKendry, a Penrith Panther. Sam played through the pain of a broken neck for 14 minutes in a rugby league match, and in an interview, his coach said, "He's a tough man, Sam. There's no doubt about that. That just typifies the way he plays." Rather than raising concerns regarding his injury, he was praised for playing with a broken neck. This shows how concussions and physical injuries are sometimes not taken seriously in the sporting world, and how players would sacrifice their health for their careers and their sporting status.
Six steps in managing concussions. The first step is to recognize the signs or symptoms of a concussion. Some signs could include blank stares, loss of consciousness, and inability to stand on your feet. Some common symptoms include headaches, dizziness, problems seeing, or fatigue. An important question to ask the injured player and to assess the situation are: where are you now? What team are you playing for? And who last scored in the game?
The second step in managing concussions is to remove any player that is suspected of having a concussion from the game immediately. If a neck injury is also suspected, only healthcare professionals should assist in helping the injured player move off the field, as not taking delicate care could cause further spinal injuries.
The third step in managing concussions is to refer. From here, all players suspected of a concussion should be referred to a medical doctor as soon as possible.
The fourth step in managing a concussion is to rest. Players should rest completely until all symptoms and signs of concussion have disappeared. The minimum rest period is 24 hours for adults, but the required rest period depends on the opinion of a medical professional.
The fifth step in managing a concussion is to recover. Once symptoms have subsided, the player can return to the normal daily activities they're used to. They should refrain from any exercise, and if symptoms reoccur, the player may need more time to rest before returning to everyday activities.
The sixth and final step of managing a concussion is to return. Once the player can engage in all normal activities without signs or symptoms of a concussion and no longer require any medical attention for their symptoms, they can return to playing rugby.
So what can still be done? For a start, players can start wearing helmets, age restrictions can be put on how old players have to be, and rules should be put into place such that injured players should have to sit out for consecutive games until x-rays clearly show no inflammation.
Professor Caroline Finch, a director of the Australian Centre for Research into Injury in Sport and its Prevention, says that no one really knows how many players are being concussed on the nation's ovals and sports grounds every week due to a lack of data. The short and long-term consequences of concussion mean that potentially years of productive life are lost, and there are substantial economic costs for individuals, families, and society.
If a rugby player suffers a serious injury that permanently impacts their ability to play, should they be held responsible for the impact these injuries will have on their lives?
They are knowingly taking part in a risky sport where the likelihood of serious injury, especially to the head, is high.
Should they be liable for assuming this risk?
In amateur league, we believe the person should be held responsible as the game is being played purely for their enjoyment. In terms of professional players, there is an overpowering body that monitors the game and should consider the impact injuries could have on players when creating and enforcing the rules of the game. So therefore, the NRL and ARU should be forced to take some responsibility or compensate their players in some way following a serious injury, as these governing bodies should be looking out for their players and their well-beings.
We thank you for listening to our presentation on Australian rugby and concussions and hope that you've learned a lot about this pressing issue. Some important points from our presentation that we would like to highlight include the following.
A concussion is a serious functional injury to the brain that should not be taken lightly. If a concussion is not taken seriously or the injured does not receive adequate rest, allowing for the brain to heal, and another concussion occurs, the results of second impact syndrome are extremely dangerous. The Blue Card system created by the ARU is an excellent step taken in taking active control to help minimize the long-term effects of brain injuries. Due to the aggressive nature of this sport, rugby should not be encouraged by parents and school systems on kids.
Finally, we hope that you will now be able to recognize the 6 steps in managing concussions, beginning with recognizing, then removing, referring, resting, recovering, and returning. If you, a loved one, or even a stranger exhibit any of the symptoms of a concussion, speak up.